Differential diagnosis. According to the Oncology Encyclopedia, the following diseases may be mistaken with the different types of leukemias based on similar symptoms that these can exhibit. Infections such as infectious mononucleosis, or IM, can present symptoms such as headache, malaise, anorexia, fatigue, fever, splenomegaly, hepatomegaly, symptoms of secondary infections, including throat or sinus infections. These are all symptoms common of both acute and chronic leukemias. However, in the diagnosis of IM, the monospot test is used, which would show a positive heterophile antibody reaction. In addition, since the most common cause of IM is the Epstein-Barr virus, a rising titer of specific antibodies for the virus's antigens is also used. In severe aplastic anemia, symptoms can mirror those of acute leukemia, which can be fatigue, headache, weakness, weight loss, palpitations, unexplained or easy bruising, nosebleeds, gum bleeding, dyspnea, recurrent or prolonged infections, pallor, petechiae, retinal hemorrhage, tachycardia, murmur, or fever. Correct diagnosis between acute leukemias and aplastic anemia can be done through bone marrow examination or oftentimes a marrow biopsy. Myelodysplastic syndromes, or MDS, are a group of disorders exhibiting abnormal growth of 3 types of stem cells. These diseases may become acute leukemia, with 40% of survivors from these syndromes developing AML. Early in MDS, patients may be asymptomatic. However, some show signs of anemia, neutropenia, and thrombocytopenia. They experience symptoms such as fatigue, dizziness, weakness, bleeding, easy bruising, and have frequent infections, which can all be symptoms of leukemia. Lymphoblastic lymphoma, although rare, it accounts for a third of non-Hodgkin lymphomas in children and adolescents, and it is sometimes thought of as a variation of ALL. However, it is considered that lymphoblastic lymphoma begins in lymph nodes or bone marrow. Similar symptoms of this disease are leukemia are night sweats, weight loss, and fever. A differentiating symptom may be that patients with lymphoblastic lymphoma experience painless swelling in the neck, armpit, or chest. In thrombocytosis, patients may develop skin bruising or bleeding from different areas such as the nose, mouth, gums, stomach, or intestinal tract. Abnormal blood clotting can also occur. These symptoms can sometimes be confused with those of CML. However, an abnormality of chromosome 22, known as the Philadelphia chromosome, would confirm a leukemia diagnosis.